Hello everyone, welcome back to my channel. Today we are discussing about diabetes medicines. Diabetes is a chronic condition affecting millions worldwide. It impacts how your body uses glucose, a type of sugar that serves as energy. When you have diabetes, your body either doesn't make enough insulin or can't use it effectively. Insulin, a hormone made by the pancreas, acts like a key, letting glucose into your body's cells for energy. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes is an autoimmune disease where the body's immune system mistakenly attacks and destroys insulin-producing cells in the pancreas. This type often starts in childhood or adolescence, but can develop at any age. Type 2 diabetes is more common and typically develops in adulthood. With type 2, the body becomes resistant to insulin or doesn't produce enough to keep up with demand. Certain factors increase the risk of developing type 2 diabetes, including family history, obesity, physical inactivity, and age. Diabetes management aims to keep blood sugar levels within a healthy range. This typically involves a combination of medication, regular monitoring, and lifestyle modifications. Early diagnosis and treatment are crucial to preventing or delaying serious complications. Not everyone with diabetes requires medication. Some individuals, especially those with prediabetes or early-stage type 2 diabetes, can manage their condition through lifestyle changes alone. This includes adopting a healthy diet, engaging in regular physical activity, and losing weight if needed. However, mostly people with diabetes need medicines to control their blood sugar levels effectively. People with type 1 diabetes require insulin therapy to survive, as their bodies cannot produce insulin. For those with type 2 diabetes, medication may become necessary when lifestyle changes aren't enough to manage blood sugar levels. The specific type and dosage of diabetes medication vary, depending on individual needs and factors, such as the type of diabetes, its severity, overall health status, and other medications being taken. Consulting a healthcare professional is vital to determine the most appropriate treatment plan. Insulin is essential for people with type 1 diabetes. If you have type 1 diabetes, you must take insulin because your body no longer makes it. There are different types of insulin that start to work at different speeds, and the effects of each last a different length of time. Your healthcare provider will measure your blood glucose to decide on the type of insulin. You may need to use more than one type. You will also need to check your blood sugar at home. Your provider will tell you how often. The results of your blood sugar testing can help you make decisions about food, physical activity, and medicines. You can take insulin several different ways. The most common are with a needle and syringe, an insulin pen, or an insulin pump. If you use a needle and syringe or a pen, you have to take insulin several times during the day, including with meals. An insulin pump gives you small, steady doses throughout the day. Less common ways to take insulin include inhalers, injection ports, and jet injectors. In rare cases, taking insulin alone might not be enough to manage your blood sugar. Then you would need to take another diabetes medicine. Type 2 diabetes, a range of treatment options. There are several different medicines for type 2 diabetes. Each works in a different way. Many of them are pills. There are also medicines that you inject under your skin, such as insulin. Over time, you may need more than one diabetes medicine to manage your blood sugar. You might add another diabetes medicine or switch to a combination medicine. A combination medicine contains more than one type of diabetes medicine in the same pill. Some people with type 2 diabetes take both pills and injections. Even if you don't usually take insulin, you may need it at special times, such as during pregnancy or if you are in the hospital. Some common classes of type 2 diabetes medications include oral anti-hyperglycemic medication can often lower blood glucose levels adequately in people with type 2 diabetes. There are several types, but oral anti-hyperglycemic medications work in four major ways. 1. Insulin secretagogues stimulate the pancreas to produce more insulin. 2. Insulin sensitizers do not affect the release of insulin but rather increase the body's response to it. 3. Some medications delay absorption of glucose by the intestine. 4. Some medications increase glucose excretion in the urine. Insulin secretagogues include sulfonylureas, for example, glyburide, glipizide, and glamperide, and meglitinides, for example, repaglinide and nataglinide. Insulin sensitizers include biguanides, for example, metformin, and thiazolidinediones, for example, pioglitazone. Medications that delay absorption of glucose by the intestine include alpha-glucosidase inhibitors, for example, acarbose and miglitol. Medications that increase glucose secretion in the urine include sodium glucose cotransporter 2, SGLT2 inhibitors, for example, canagliflozin, dapagliflozin, and empagliflozin. Dipeptidyl peptidase 4, DPP4 inhibitors, for example, sitagliptin, saxagliptin, linagliptin, and alogliptin, both stimulate the pancreas to produce more insulin and delay the absorption of glucose by the intestine. These medications work by increasing glucagon-like peptide 1, GLP-1. If diet and exercise fail to lower the levels of glucose in the blood adequately, people with type 2 diabetes are often prescribed anti-hyperglycemic medications. One medication or multiple medications may be started at the time of diagnosis, depending on the glucose levels and the need for weight-lowering medication. A common first-line medication is metformin, but more than one type of oral medication, an oral medication plus insulin, an injectable glucagon-like peptide 1, GLP-1 medication, or a combination medication containing GLP-1 and glucose-dependent insulinotropic polypeptide, GIP, may be used if one medication is not adequate. The treatment of diabetes often requires medication adjustments and addition of medications over time. Living well with diabetes. It takes more than medicine. While medication is often necessary to manage diabetes, it's not the only aspect of treatment. A comprehensive diabetes management plan also includes lifestyle modifications to control blood sugar levels and prevent complications. Healthy diet. Eating a balanced diet low in refined carbohydrates, unhealthy fats, and added sugars is crucial. Focus on consuming plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. Regular exercise. Physical activity improves insulin sensitivity and helps regulate blood sugar levels. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week. Weight management. Losing even a small amount of weight can significantly improve blood sugar control and reduce the risk of diabetes-related complications. Blood sugar monitoring. Regularly checking blood sugar levels helps track medication effectiveness, identify trends, and make necessary adjustments to treatment. In conclusion, understanding diabetes and its treatment options is essential for managing the condition effectively. Whether through insulin therapy, oral medications, or lifestyle changes, the goal is to maintain blood sugar levels within a healthy range. By working closely with healthcare professionals and adopting a holistic approach to diabetes management, individuals can live full and healthy lives. Thanks for watching my video. Please like and subscribe for more informative video. Stay healthy.